Good morning, everyone. It's Thursday, April 30th, and we thought we would try this way of communication to you on some updates of what's going on around our facilities here. First, I just want to start out by saying thank you to all of you who have helped in so many ways around the facility. We have our mask makers and cleaners and pantry store volunteers and tray volunteers, but every department gives you high praise for how you've pitched in and helped us, and also just with your support and comments. So thank you for all that you're doing. We greatly appreciate it. It makes a difference in our lives each day. We're experimenting with this to see how this works for you. So if this is something you'd like to see more of in terms of a communication to you, we're happy to do that and can pick topics that you might be interested in, as well as updates that we would have to give you. So let the front desk know if this is something you'd like to see more often. I'm going to cover just a few things today that come up quite often with questions, or that we're doing behind the scenes that you might find of interest. The first thing is self-quarantine of residents. So we are tracking that in the office, and we track it for those residents who have gone out in the community for a reason, and we will let them know when their time is up, and we do that by telephone as well as a note thanking them for their help. We also do that for any returning residents, so that we communicate with them well in advance before they come back. They're screened and tracked, and so if you ever wonder who's kind of watching all this, we are watching this, and the residents and the families are well aware also. The other thing behind the scenes that we're working on is supplies and food. I'm sure you've read a lot in the papers and hear a lot about the media about the shortage of certain kinds of medical supplies, and we are certainly experiencing that. We are not to a level that we need to be concerned, but we are using a lot of them. They've gotten very expensive, and our access to them is somewhat limited, but again, we're not to a point that it's a huge concern, but we're spending a lot of time daily acquiring supplies. The other area that seems to change almost weekly for us is food deliveries. We'll put in our normal order, and we really don't know what we're going to get until the day it's delivered. We get updates from our vendors of what to expect, and so for example this week we've been told to expect here this next few weeks a shortage of meat and a shortage of vegetables. And I'm sure if you watch the media and read the newspaper, you know why all that is going on. So we expect to see some of that occur. Yet Ryan and his staff are doing an outstanding job of staying on top of it, making changes to the entrees and menus as needed. So again, we appreciate your cooperation there as well. We also have the flexibility or the opportunity to visit other facilities in the state as well as outside the state who have gone through this, and that's been a great help to us. You sometimes learn the best from others who have gone through something that we haven't yet. And so we do that routinely and get updates. We're also in almost daily communication with the Department of Health, the CDC, CMS, and Monument Health as well, on the latest, greatest of what's going on with the COVID virus and what next steps might be occurring, period. For example, the health department came and have been doing surveys of facilities. They told us they chose our facility first to come to because they knew that we would set the bar. And when they left, they said, "You guys are doing an outstanding and excellent job." You don't hear that much from people whose job is to find fault in what you're doing. So we know what we're doing is pretty rock solid. You may have heard Governor Noem's address Tuesday, where the plan to come back to more of a normal operation within the state, and of course Mayor Allender's address about starting to take steps in our Rapid City community. You'll also notice that in Governor Noem's address, she mentioned that the areas that they're not addressing at this time are senior living facilities. Well, that fits us. You know, our population here at all of our locations would be considered that vulnerable population. So even as we hear things start to change in the state of South Dakota, and maybe even in this community of Rapid City, we won't be making changes until such time the data shows that it's okay to move ahead and do some things differently. And that could change soon, or that could change later down the road. And again, we're going to use the science of this, not the emotion of this, to make good, rational decisions. Our number one concern is the safety of the residents and the safety of the people who work here, and everyone else's families involved in this as well. So I think that's just kind of a brief update that we wanted to give you. See how this line of communication works for you. Again, we greatly appreciate your cooperation and support that you give us in so many ways. And we'll look forward to hopefully some good new news about the COVID-19 virus down the line. Thank you and have a great week.